She fills her glass the same way every night, 8 ounces, sometimes more, because she read somewhere that hydration is protective, and she has been careful about her health for years. She drinks it standing at the sink, sets the glass down, brushes her teeth, and gets into bed feeling like she has done something right. 2 hours later, she is awake again. She makes the trip to the bathroom in the dark, climbs back in, and lies there for a while before sleep returns. This is just how nights are now, she thinks. But it does not have to be. The connection between evening hydration habits and nighttime urinary disruption is one of the most practically actionable conversations in urology, and one of the least likely to happen during a standard primary care visit. Doctors talk about hydration in broad terms. Drink enough water, aim for a certain daily volume, monitor the color of your urine. What rarely gets addressed is the timing, the type, and the amount of fluid consumed in the final hours of the day, and how each of those variables interacts with a bladder and kidney system that, after 60, operates by a significantly different set of rules than it did at 40 or 50. That gap is what I want to close today. My name is Dr. Evan Noris. I am a urologist with 18 years of clinical experience focused on bladder health, kidney function, and urinary dysfunction in adults over 60. What brought me to this specific video is how consistently I see nighttime sleep fragmentation traced directly back to evening fluid habits that patients were never given the information to change. After 60, 3 biological shifts converge to make the timing of fluid intake more consequential than most people realize. First, the kidneys gradually lose some of their ability to concentrate urine efficiently during the night, meaning they produce more urine in a given period than younger kidneys would from the same fluid load. Think of the kidney like a filter that has become slightly less efficient at its lowest demand setting. It keeps working, but it cannot slow down as completely as it once could. Second, antidiuretic hormone, the signal that tells the kidneys to reduce output during sleep, declines in its overnight effectiveness after 60, weakening the body's natural nighttime braking system. Third, bladder capacity decreases and bladder wall sensitivity increases, meaning smaller volumes trigger the urge to go. When these 3 shifts are already in place, and you then add a meaningful amount of fluid in the 2 to 3 hours before sleep, the result is a compounding pressure on a system that was already operating near its nighttime ceiling. The broken sleep that follows is not trivial. Research in sleep medicine reviews has documented that fragmented sleep in older adults is significantly associated with accelerated cognitive decline, elevated fall risk during nighttime bathroom trips, and reduced immune resilience over time. The quality of your nights is inseparable from the quality of your days. Before I walk through the 5 evening water mistakes most seniors make without realizing it, I want to ask you something. How many times do you typically wake up to use the bathroom on a given night? Just type a number in the comments. 1, 2, 3, or more. Understanding where people are starting from helps me make this conversation as useful as possible. The first mistake is the most common one, and it is also the one that feels most virtuous. Drinking a full glass of water immediately before getting into bed as a final health habit of the day. The logic behind it is sound. Overnight is a period of mild fluid loss through breathing and perspiration, and entering sleep well hydrated seems like sensible preparation. The problem is the timing. A full glass of water consumed within 30 minutes of lying down arrives at the kidneys at precisely the moment the body is transitioning into its nighttime filtration mode. Because the kidney's ability to slow output after 60 is reduced, that glass of water does not simply sit quietly in reserve. It moves through filtration and reaches the bladder within 1 to 2 hours at full volume, while you are in the middle of your lightest sleep. A woman named Constance, a former hospital administrator who brought the same organizational discipline to her personal health that she had applied to running a department of 200 people, came to see me after 2 years of waking at 2 in the morning with extraordinary consistency. Her evenings were structured and intentional. She had added the bedtime glass of water after reading about overnight dehydration in a health column, and had never connected it to the 2 o'clock waking that began shortly afterward. Removing the bedtime glass and shifting that fluid intake to 6 o'clock instead resolved the 2 o'clock waking within 10 days. The practical fix: Stop drinking any significant volume of fluid at least 90 minutes before you intend to go to sleep. If you take medication at bedtime, a few small sips are sufficient. Ask your pharmacist which of your medications genuinely require a full glass. The second mistake involves the type of fluid consumed in the evening hours, and specifically, the widespread belief that herbal tea at night is categorically safe for bladder health. Many herbal teas are genuinely calming and beneficial for sleep preparation, but a meaningful number of popular evening teas, including green tea, certain detox blends, and some chamomile combinations with added botanicals, contain caffeine or theophylline, a related compound that acts directly on the kidney to increase urine production. The effect is not large, but in a bladder that is already more sensitive and a kidney system that is less able to buffer overnight output, even a mild diuretic effect added to the volume of 2 large mugs of tea in the evening is a compounding load. A man named Stavros, a former marine navigator who had the kind of precise situational awareness that comes from spending decades reading complex systems, came to see me after noticing a pattern he could not account for. On nights when he skipped his evening tea ritual, his sleep was noticeably less interrupted. On nights when he had 2 mugs, he was up twice before 4 in the morning. He had already done most of the diagnostic work himself, but had not found confirmation that the tea was the culprit. A review of his specific blend confirmed a modest caffeine content listed in the fine print of the ingredients. Switching to a verified caffeine and theophylline-free variety in a single smaller cup, finished by 7:30, confirmed what he had suspected. The practical fix: read the full ingredient list of any herbal tea you drink in the evening. Look specifically for green tea extract, mate, or guarana among the listed botanicals. If you cannot confirm it is completely caffeine-free, treat it as a potential contributor to nighttime waking. The third mistake is one that operates entirely below the level of conscious awareness, because it has nothing to do with what you drink and everything to do with what you eat. Specifically, the sodium content of your evening meal. Salt causes the body to hold fluid in the bloodstream and tissues during the hours after eating. As the evening progresses and you move from upright to horizontal, fluid that has been retained in the legs and lower body during waking hours begins to redistribute into central circulation. The kidneys, now receiving that shifted fluid volume, must process it, and they do, steadily, through the night. Research from Nagasaki University, published in the journal Nutrients in 2017, found a significant and measurable association between high dietary salt intake and nocturia frequency in older adults, and found that reducing salt intake produced meaningful reductions in nighttime urination episodes in study participants. Think of high-sodium dinner as a time-delayed fluid delivery to the kidneys. You are not drinking water at 10 at night, but your body is acting as though you are, because the salt is releasing the fluid it held during the day. A woman named Beatrice, a former art restorer with a detailed and methodical approach to every problem she encountered, arrived at my clinic convinced that her bladder was simply failing her. She had cut her fluid intake after 5 o'clock to almost nothing, and still woke twice each night. When we mapped her full day, rather than just her beverages, her evening meals were consistently high in sodium, processed soups, cured meats, restaurant meals several times a week. Shifting to lower sodium evening food reduced her nocturia episodes from 2 to 1 within 5 weeks, and to occasional within 2 months. The practical fix: pay the same attention to the sodium content of your dinner plate that you pay to your water glass. The two are not separate variables. They work as a system. If you are still here and finding this useful, type the word sleep in the comments right now. Staying through the full conversation is exactly what separates the people who act on this from the people who mean to. The fourth mistake is one that accumulates across the day rather than at night, and it is counterintuitive enough that many people push back when I first describe it. Not drinking enough water during the morning and early afternoon. When fluid intake is too low through the first half of the day, the body enters a state of mild dehydration by mid-afternoon. In response to this, 2 things happen. First, the body increases the concentration of the urine it produces, which irritates the bladder wall. A more concentrated urine is more chemically stimulating to sensitive bladder tissue, lowering the volume threshold that triggers the urge to go. Second, People who feel the effects of afternoon dehydration, dry mouth, fatigue, slight headache, compensate by drinking more in the late afternoon and evening to catch up. This catch-up drinking is the fluid load the nighttime kidneys cannot manage. The result is an unnecessarily disrupted night, caused not by drinking too much in the evening in isolation, but by the combined effect of under-drinking earlier and overcorrecting later. A man named Rafferty, a former structural engineer, who was meticulous about everything related to load and timing in his professional life, but had never applied that thinking to his own hydration schedule, came to see me with persistent nocturia that he described as baffling because his total daily fluid intake was appropriate. When we mapped the distribution across his day, he was consuming less than a cup of fluid before noon and making up the difference from 4 in the afternoon until bedtime. Redistributing the same total volume, front-loading it into the morning and early afternoon, with almost nothing after 7, reduced his nighttime waking significantly within 3 weeks. The practical fix: hydrate deliberately and steadily through the first half of your day. Keep a glass of water at breakfast, another at mid-morning, another at lunch. Your kidneys handle the same volume of fluid very differently at 10 in the morning than they do at 10 at night. The fifth mistake is one that is almost universally overlooked, because it takes place not at the kitchen sink or the dinner table, but in the living room chair. And that is, spending the evening hours sitting with minimal movement, allowing fluid to pool in the legs and feet. When you sit for extended periods, gravity draws fluid out of circulation and into the soft tissues of the lower legs and ankles. This fluid is not lost. It is waiting. The moment you lie down and gravity no longer acts in the same direction, that fluid returns to circulation and is delivered to the kidneys for processing, typically within the first 1 to 2 hours of sleep. For someone over 60 whose kidneys cannot slow their output efficiently, this fluid return is an additional, late-arriving load on top of whatever the evening's drinking has already produced. A woman named Yolanda, a former documentary producer with an instinct for finding the frame that made a story make sense, came to see me after noticing that her worst nights were always the ones when she had spent the most time in her armchair. She had assumed it was coincidence. When we talked through the physiology, the frame became clear to her immediately. Adding 2 brief evening walks, one before dinner and one about an hour afterward, moved the fluid through her circulation and into kidney processing before she lay down, rather than while she slept. Her nightly waking pattern improved measurably within 2 weeks. The practical fix: avoid extended stationary sitting in the 2 to 3 hours before bed. Even a 10 to 15-minute walk in the early evening helps drain the fluid that would otherwise arrive at your kidneys at midnight. Here is what I want you to do starting tonight. And I want to say this the way I would say it sitting across from you in my office after a full conversation. Stop drinking meaningful volumes of fluid at least 90 minutes before bed. A few sips for medication is fine. A full glass is not. Check your herbal tea and confirm it is genuinely free of caffeine and related compounds. Look at the sodium content of your evening meal and ask whether it is contributing to a fluid load you cannot see. Starting tomorrow morning, drink water deliberately from the moment you wake up, with breakfast, mid-morning, at lunch, so that you arrive at dinner already well hydrated and have no need to catch up. And take a short walk in the evening, before or after dinner, to move the day's pooled fluid through your system before sleep. These are not extreme or difficult changes. They are small, specific adjustments to a daily rhythm that was never examined from this angle. Done together, they give your body the conditions it needs to let you rest. Everything I have shared today is a starting point for a conversation with your own physician, not a treatment plan designed for you specifically. Your kidney function, your bladder history, your medications, and any other conditions you are managing all shape what the right approach looks like for your individual situation. Please bring these ideas to your doctor. They want to have this conversation, and you deserve the time to have it fully. And if reclaiming your nights has you thinking about how sleep quality shapes your broader health, the next topic I want to explore with you is how fragmented sleep in adults over 60 directly affects blood sugar regulation, and what you can do about it starting tonight.